How's it going? My name is Brandon now. Didn't have a piece of paper, so I'm using this whiteboard. It is July 5th, and um, basically I also used this whiteboard to use it for notes. And I kind of just used it as to tell the order, so I wouldn't forget one, and then pictures to just help me not forget the examples. But that being said, let's just jump right into it. A disease, that's pretty much anything that entered the body, or maybe it was already there through genetics. But basically, that's anything that causes a cessation or an interruption within the body or an organ structure. And so this can be told through an etiologic agent or a signs or any symptoms at all. And some examples can be chickenpox or even HIV. Next, we got disease classification, and kind of it's what it sounds like. You're classifying these diseases. Um, and some of the classifications are etiologic agents. We have pathogenesis. You've got clinical manifestations. You've got diagnosis. That's one, and then you've got clinical course, and those are just how we classify these diseases. Next, we have pathogenesis, and so this is basically how the disease evolves. An example of this is, like I said earlier, HIV. You have a disease, comes into your body, starts destroying immune cells, and then over time it transforms into a more severe case known as AIDS, and then from there, once you get treatment, you could be in for a bad time, settle for death. But yep, like I said, pathogenesis, just how the disease kind of evolves over time. Next, we got symptoms, which I'm sure a lot of people have heard of, and these are basically how you can tell from a disease. They're mainly subjective, and they're the things that are the patient is kind of feeling, as you'd say. And these are something that the provider cannot really see themselves, and they kind of have to be told from the patient themselves what's going on with them. And an example of this can really be a headache, because obviously the provider can't feel their headache or see that they're having a headache, and any pain, because the provider can't feel their pain or anything. Next, we have signs, which is the same, kind of like symptoms, except they're objective. And while the patient is feeling them and has to go through it, the provider can also kind of see what they're going through and make the judgment call themselves as well. An example of this is any rash you might have on your hand, or even jaundice, which is just yellowing of the skin. These are physical things that the provider can look at or sense and kind of just see in general. Next, we got syndromes, and syndromes are just a combination or a group of symptoms and signs that occur around the same time. An example of this would be irritable bowel syndrome, which occurs within the large intestine, and so the patient's kind of just feeling a whole bunch of signs and symptoms at the same time, such as cramping, might be diarrhea, or any pain in the stomach. These are just all things that are just occurring relatively at the same time. Next, we have diagnosis, and this can be how the doctor, so they see the medical problem, and they can, by gathering, certain clues, or history, family history, or what happened, how they may have, what may have caused it. They can determine what they're dealing with, in a sense. An example of this can be if a patient was playing football. It's a high contact sport. They come into the doctors and they said that they injured their head. Well, the doctor can gather more questions. How did they injure it? How hard were they hit? What are their What are the signs and any symptoms that they're feeling? And then from there, they gather the information, and the doctor can, after gathering that data, they can safely say that maybe this patient has a concussion. Complications. So complications are kind of what the word sounds like. These are just medical problems. Sometimes that occur that like the provider was not expecting, and this can occur if through like a disease or even through surgery. And an example would be if the patient is going through surgery and maybe went through like an allergic reaction to the anesthesia. And so they would consider that a complication. Next we got prognosis, and pretty much this is prognosis. Oh, this is how the doctor is going to. They basically know what's going to occur within the disease, or they have a pretty good idea, and they know like what the end might be, and like the stages of the disease, and I guess the outcome of the disease is what I'm trying to say. And an example of this would be like a common cold. You start out like within a couple days, you're sneezing, maybe you're coughing, you've got some phlegm in the back of your throat, whatever the symptoms and signs might be. After a week, maybe you're at your worst, you're at the peak of the disease, you're feeling the worst, maybe some soreness in the muscles, and then after 2 weeks, you are healthy and you are fully recovered and you do not feel sick anymore. You're going to be perfectly fine after the common cold. And then last but not least, we got diagnostic tests. These are pretty much tests to determine what disease or medical problem they might have, like to test for it. And an example for this can be if a patient thinks they might have breast cancer, they go into the doctors and they get a mammogram. And so the doctor checks their breasts to see if there's any lumps of some kind. And if they find some, then they can use that information to determine whether they might have breast cancer. And if not, then that's that. And yeah, it's like a way of screening to see if you have a disease or any kind of condition. But other than that, that's about it. Thank you for listening, and I'll see you soon.